Hello, everyone. Today is day 5 post-op from my uh, anterior cervical discectomy and hybrid fusion. And what I've learned in the past 5 days is the procedure is much more intense than the lumbar fusion. The lumbar fusion, I didn't have really any pain. There might have been some minor back spasms in the first 2 or 3 days. It lasted 5 or 10 seconds. Other than that, I really didn't have any discomfort. This has been very uncomfortable. The first 2 days were very painful. I was taking a combination of Norco and Soma and Tylenol PM, and just trying to keep myself knocked out as much as I could during the day. And then, let's see, Thursday, I only had to take the Norco, I think, once, maybe twice. And I added in 800 milligram ibuprofen to deal with the inflammation. The pain is mostly in the back of my neck, going down into my shoulders. And the doctor said that's something that I could anticipate because there have been so many years of degeneration, and the length of the muscles and the tendons and the ligaments, they all just kind of shrink. And then he's stretching them back out. So for me, they did 3 levels. They did C3, C4, C5, C4, C5, and C5, C6. So the bottom two, they removed the discs, they put in the spacers, and they fused that area. And then the top, he did an artificial disc replacement. So it's a little more extensive than most, which makes sense why I'm having so much inflammation. But as far as pain goes, like I said, today's day 5. It's really manageable. I'm not taking the Norco. I'm just taking the anti-inflammatories during the day. I'll take the muscle relaxer maybe once during the day and then at night. And then I'll take the Tylenol PM as well. I've had a problem sleeping, not exactly sure why. Just haven't been able to knock myself out, and so I'm tired pretty much most of the day. I'm swallowing fine. The swelling around the incision has gone down. There's a little bit of swelling on this side. There was some swelling in the back. That's gone down. But I would say I'm pretty much on track as expected. The only thing out of the norm I would say that I'm experiencing is I've got numbness in the tip of my tongue, and I've got a kind of a chemically plastic taste in my mouth. So I don't know if the anesthesiologist, I don't know if he was putting some kind of numbing medication in there when he was putting the tube in and something happened on my tongue. It's to be expected that you would have some numbness on your tongue because all the swelling in your throat and around that area. It does make sense. The taste, that I'm not 100% sure of. But when I brought this up with my surgeon, he's like, don't worry about it. You know, that will ease off in a couple of weeks. And for most of the people that I've spoken to who've had the procedure or a similar procedure, the first couple of weeks are the slowest and the toughest. And you can anticipate the difficulty during that time. After that, I think it's just going to be a question of doing the stretching, which is basically your rotation. The only area that I feel any kind of discomfort is right in the back of my neck when I'm getting down to like 4 o'clock, 5 o'clock. that seems to be a little bit painful, but not anything that I would say is harsh or intolerable. Um, and my voice is almost back to normal. I'm a little hoarse, um, and swallowing is not 100%. I would say it's probably 90%. I could still feel the inflammation in my throat as I'm trying to eat. So, if you're going to have this procedure done, my advice would be the first couple of days, Jello, and maybe applesauce. Don't have anything too heavy like yogurt, ice cream, cottage cheese, anything like that, because it builds up the mucus, and you're going to have a lot of inflammation in there. The yogurt was really easy to eat. The applesauce was really easy to eat. So that's what I stuck with. I think the first real meal that I had was maybe on Wednesday, and I had just some scrambled eggs. That was easy. Have some soup. I tried to have a normal meal, which I made myself, a hamburger, and it was a little difficult, even when I was, taking really small bites. So I think that was just me trying to see if I could push the limits and handle things within inside of a week. But outside of the first week, I think you're fine. Inside, just make it easy to eat, soft, and lots and lots and lots and lots and lots and lots of water, and ice packs. Um, I'm a little confused about ice versus heat, because it seems in the back of my neck the muscles are strained, so normally I would use heat. I understand that the swelling's there, so you have to have ice to reduce the swelling, but you have to have heat to reduce that strain. I'm kind of doing both. I'm doing 20 minutes of ice and 20 minutes of heat every couple of hours, and it seems to be doing the trick, but the reality is I think the ice works best as far as keeping the pain under control. Anyway, again, the lumbar fusion versus the cervical procedure. The lumbar was such an easy thing to go through. It was just like a dream procedure. I've had no issues. I'm back to 100%. The cervical issue is, I would say, way more complicated. You really have to have the best surgeon that is available, so you have to do your research, and it's going to make a huge difference. Dr. Barkahana is an expert, and I trusted him 100%, and I think that the outcome that I'm going to have is going to be the same outcome that I'm getting with my lumbar fusion. It's just going to take time, and basically he said no physical activity, no physical therapy for 2 months. So, you really have to take it slow in this type of procedure. Anyway, I hope I've provided some answers to questions you might have if you're looking at a possible procedure in your cervical region. There's lots of info on YouTube to look at, so I would encourage you to do that. And if anybody has any questions, please feel free to ask, and I will talk to you in a few weeks. Thanks.